You've been misinformed your entire life regarding physical activity. Every medical professional, every fitness publication, and every well-intentioned relative has conveyed the same message. Increase your movement. Achieve your daily step goals. The notion that 10,000 steps a day will ensure your well-being is pervasive. However, here's a truth that many prefer to keep concealed. A seminal study conducted at the University of Missouri, released in the year 2023, yielded findings that astonished the entire medical establishment. Investigators discovered that individuals aged over 60 who engaged in specific exercises performed while seated demonstrated a 27% greater enhancement in functional strength compared to those who solely focused on walking. 27%. This is not an insignificant disparity. It represents the difference between being capable of lifting your grandchildren and experiencing difficulty rising from a chair. The entire walking apparatus, encompassing footwear manufacturers, fitness trackers, and treadmill producers, has cultivated a multi-billion-dollar enterprise around the concept that walking is the preeminent form of exercise for older adults. Yet, orthopedic surgeons have been aware of the reality for decades. While walking is undeniably beneficial for cardiovascular health, it contributes minimally to combating the muscle deterioration that commences its assault on the body after the age of 60. This physiological decline is termed sarcopenia, and it systematically diminishes muscle mass by approximately 3 to 5% every decade after one reaches 30 years of age. By the time individuals reach 70, they may have lost as much as 30% of their inherent strength. Walking is incapable of arresting this process, but these 5 seated exercises can. A study from Harvard Medical School in 2022, which monitored over 2,000 seniors for a period of 18 months, revealed striking results. The cohort participating in seated resistance movements experienced an increase in muscle mass, whereas the walking group saw a reduction. These participants were of the same age and had comparable health conditions, yet the outcomes were entirely divergent. Furthermore, the most remarkable aspect of this research, particularly the top-ranked exercise we will unveil shortly, demonstrated a 19% boost in bone density among participants over 65. Medical practitioners specializing in orthopedics are now routinely recommending this precise movement to patients recuperating from hip replacement surgery, citing its superior efficacy over any physical therapy regimen they have previously employed. Before we commence, please share your age and your current location in the comments section. We diligently review and respond to every single comment. Now, without further delay, let us begin with the 5th exercise, which may well surprise you. At number 5, we have seated calf raises. Let us address the exercise that most individuals completely overlook, and this oversight is directly contributing to a loss of their autonomy. Seated calf raises may sound deceptively simple. You sit in a chair and lift your heels off the ground. How challenging could that possibly be? However, this action specifically targets the most undervalued muscle group in your entire lower body, your calf muscles. The gastrocnemius and soleus muscles are responsible for a vital function known as the venous pump. Each time these muscles contract, they compress the veins in your lower legs, propelling blood back towards your heart. This is of critical importance because blood must actively contend with gravity to return from the extremities. In the absence of robust calf muscles, blood tends to pool in the lower limbs, leading to swelling varicose veins and a substantially elevated risk of dangerous blood clots. A comprehensive study published in the Journal of Applied Physiology in 2021 analyzed 140 seniors who presented with mild circulatory issues. Half of the participants engaged in seated calf raises 3 times per week, while the other half maintained their usual routines. After a 12-week period, the group that performed the exercise exhibited a 41% improvement in venous return efficiency. Their ankles showed reduced swelling, their legs felt lighter, and, most importantly, their risk factors for deep vein thrombosis decreased significantly. While walking does involve your calves, it does not engage them with the same focused intensity. During locomotion, numerous muscles share the cumulative workload. Conversely, when you perform seated calf raises, you isolate these essential pumping muscles, compelling them to exert greater effort. To execute this exercise correctly, position yourself in a stable chair with your feet flat on the floor, ensuring your knees are bent at approximately a 90-degree angle. Now, press through the balls of your feet, elevating your heels as high as possible. Sustain this elevated position for a full 2 seconds, actively feeling a strong contraction in the back of your lower legs. Following this, slowly lower your heels back to the floor. This deliberate lowering phase is crucial as it facilitates eccentric contraction, a process that is more effective in building muscle than the lifting phase alone. If you are new to exercise, commence with 15 repetitions. Gradually progress to 3 sets of 25 repetitions. Once this becomes manageable, place a substantial book or a small weight across your thighs to introduce added resistance. This additional load will accelerate your progress in building strength. Surgeons particularly favor this exercise due to its applicability even for patients experiencing hip or knee complications, as it places no undue stress on those joints. All the exertion is concentrated in your ankles and calves. Perform this movement daily, ideally once in the morning and again in the evening, and you will likely notice a remarkable improvement in leg comfort within just 2 weeks. Now, let us transition to an exercise that addresses an entirely different physiological concern. Before we proceed, if you're finding this video beneficial, please click the like button to ensure it reaches more seniors, and subscribe to our channel. We are consistently publishing valuable content focused on senior health, and you will not want to miss our upcoming videos. At number 4, we have seated knee extensions. This exercise specifically targets a muscle group critical for fundamental movements such as ascending stairs, exiting a vehicle, or standing up from a toilet without assistance, your quadriceps. These are the substantial muscles located at the front of your thighs, playing a primary role in all these daily activities. Unfortunately, they deteriorate at a faster rate than almost any other muscle group as we age. Research conducted at the University of Vermont and published in 2020 found that adults over 60 experienced a nearly 2-fold rate of quadriceps strength loss compared to younger individuals. This study tracked 400 participants over a 5-year span and revealed that those who did not engage in targeted leg exercises lost an average of 16% of their thigh muscle mass. In stark contrast, the group that performed seated knee extensions 3 times weekly actually gained 4%. This translates to a significant 20% difference in outcomes attributable to one uncomplicated exercise. Herein lies the reason why walking proves insufficient in safeguarding your quadriceps. When you ambulate on level terrain, your quadriceps muscles are minimally activated. They engage slightly as you swing your leg forward, but they are never subjected to significant resistance. Your body adapts to the demands placed upon it. If you consistently fail to challenge your quadriceps, they will inevitably diminish. Seated knee extensions compel your quadriceps to elevate your entire lower leg against the force of gravity, thereby generating the resistance signal necessary for muscle growth. To perform this movement, sit upright in your chair with your back firmly supported against the backrest. Grasp the sides of the seat for stability. Now, extend one leg straight out in front of you until your knee is fully straightened, with your toes pointing towards the ceiling. Hold this position for 3 seconds, intensely contracting the muscles in your thigh. You should experience a distinct burning sensation in the front of your leg. Subsequently, slowly lower your foot back to the floor over a 4-second count. Switch to your other leg and repeat the process. Aim for 12 repetitions on each side. Allow for a 30-second rest period, followed by 2 additional sets. The key to maximizing the benefits of this exercise is the forceful contraction at the apex of the movement. Do not merely lift your leg and let it hang passively. Actively contract your quadriceps with such intensity that you feel as though you are trying to make the muscle bulge outwards. This mental engagement with the muscle dramatically enhances its activation. A study published in the European Journal of Applied Physiology in 2023 demonstrated that participants who consciously focused on squeezing their muscles during exercises achieved 31% greater strength gains compared to those who simply went through the motions. Once bodyweight knee extensions become facile, you can introduce resistance by wearing ankle weights or by looping a resistance band around your ankles. Begin with 2 pounds and gradually increase the weight over time. Orthopedic surgeons advocate for this exercise for all individuals over 60, as robust quadriceps muscles provide crucial protection for the knees against the progression of osteoarthritis. These muscles function as a shock absorber, effectively reducing the stress placed on your knee joints with every step you take. The subsequent exercise will likely surprise you, as it targets a muscle group you may have entirely forgotten existed. At number 3, we have seated hip marches. The muscles responsible for hip flexion are the hidden orchestrators of your ambulatory capabilities. These muscles, primarily the iliopsoas and rectus femoris, are responsible for lifting your thigh towards your chest with every single stride. When they weaken, your gait undergoes a transformation. You begin to shuffle rather than step, and your feet barely clear the ground. This is precisely why so many seniors stumble over seemingly innocuous obstacles. Their hip flexors have become too feeble to adequately lift their legs. A landmark study from the Mayo Clinic published in 2022, meticulously analyzed the gait patterns of 800 adults aged between 60 and 85. The researchers concluded that hip flexor weakness was the single most significant indicator of fall risk. Participants exhibiting the weakest hip flexors were found to be 4 times more prone to experiencing a fall within the subsequent year. 4 times more likely. Falls are not mere minor inconveniences for seniors. They are often life-altering events. According to the Centers for Disease Control, 1 in every 4 adults over the age of 65 experiences a fall annually. Of these falls, 20% result in severe injuries, such as fractured bones or head trauma. Hip fractures, in particular, are devastating consequences that frequently initiate a downward spiral in health. Tragically, 30% of seniors who sustain a hip fracture pass away within 1 year. This information is presented not to instill fear, but to serve as a powerful motivator. Seated hip marches directly fortify the muscles that are instrumental in preventing falls. This exercise effectively mimics the natural motion of walking, but with an increased level of resistance and control. You are actively training your hip flexors to lift your legs with greater height and power than they would typically achieve during a normal walk. To perform this exercise, sit towards the front edge of your chair, avoiding leaning back against the backrest. Maintain an erect spine and gently engage your core muscles. Now, lift your right knee towards your chest as high as you can comfortably manage, bringing your foot off the floor. Hold this position at its peak for 2 seconds, feeling the exertion in the front of your hip. Subsequently, slowly lower your foot and repeat the motion with your left leg. This constitutes 1 complete repetition. The slower you execute this movement, the more effective it becomes. Avoid using momentum to swing your legs upwards. Instead, lift them through pure muscular effort. Aim for a total of 20 repetitions, alternating legs with each lift. Complete 3 sets, incorporating a 1-minute rest period between each set. To further enhance the challenge, extend the duration of your hold at the elevated position to 5 seconds instead of 2. Additionally, once the basic movement becomes effortless, you can incorporate ankle weights to increase the resistance. Medical professionals specializing in orthopedics have observed that patients who consistently perform hip marches prior to undergoing joint replacement surgery experience a notably faster recovery period afterward. Their muscles are already adequately prepared and strengthened, which significantly streamlines the rehabilitation process. This exercise also contributes to improved balance, as it necessitates the engagement of your core muscles to stabilize your body while one leg is raised. We are now approaching exercises that orthopedic surgeons deem indispensable for maintaining independent living. At number 2, we have seated rows utilizing a resistance band. Every action you undertake requires pulling strength, opening doors, rising from bed, dressing yourself, carrying shopping bags, and even embracing loved ones. All of these activities depend on the musculature of your back, specifically your latissimus dorsi, rhomboids, and posterior deltoids. These are the muscles that prevent the development of the stooped posture that afflicts so many older adults. When your back muscles weaken, gravity begins to gain the upper hand. Your shoulders round forward, and your upper spine curves into a condition medically termed kyphosis. This postural deviation is more than a mere cosmetic concern. It compresses your lungs, impeding respiration. It shifts your center of gravity forward, escalating the risk of falls. It also contributes to chronic neck and shoulder discomfort due to the forward protrusion of your head, which strains the supporting muscles. Walking provides absolutely no benefit for these specific muscle groups. During a walk, your arms swing passively at your sides, involving no pulling motion. This is precisely why numerous individuals who are diligent walkers still develop poor posture. They have neglected their entire posterior kinetic chain. A study published in the American Journal of Physical Medicine and Rehabilitation in 2021 followed 300 seniors through a 6-month exercise regimen. One group focused exclusively on walking, while the other engaged in seated rowing exercises with resistance bands. At the conclusion of the study, the rowing group demonstrated an average improvement of 8 degrees in spinal posture, whereas the walking group showed no discernible change. Furthermore, the rowing participants reported a 63% reduction in upper back and neck pain. To perform seated rows, you will require a resistance band. These affordable implements provide variable resistance, making them ideal for seniors as they are gentle on the joints while being highly effective for strength development. Sit in your chair with your feet flat on the floor, positioned approximately hip-width apart. Loop the resistance band around the soles of your feet, holding one end of the band in each hand. Sit up straight with your arms extended forward, maintaining slight tension on the band. Now, pull your elbows back, actively squeezing your shoulder blades together as if you were attempting to hold a pencil between them. Your hands should move towards your rib cage. Hold this contracted position for 2 seconds, consciously focusing on engaging the muscles located between your shoulder blades. Following this, slowly release the tension and extend your arms forward again, ensuring you do not allow the band to snap back. Maintain control throughout the return motion. Perform 15 repetitions per set, completing a total of 3 sets. The resistance level of your band is important. You should be capable of completing all 15 repetitions, but the final 3 should feel challenging. If it feels too easy, opt for a thicker band or double up your existing band to increase the tension. Surgeons frequently recommend this exercise to patients recovering from spinal procedures, as it builds the crucial muscular support system that protects the spine. Strong back muscles function akin to guy wires on a tent, maintaining proper alignment of your vertebral column and preventing degenerative changes. This brings us to what is considered the paramount exercise, the one that surgeons are prescribing more than any other. At number 1, we have sit-to-stand squats. If you were to perform only a single exercise for the remainder of your life, this should be it. The sit-to-stand squat transcends mere exercise. It serves as a diagnostic indicator of longevity. Researchers have discovered that an individual's capacity to execute this movement accurately predicts their risk of mortality. A notable study published in the European Journal of Preventive Cardiology monitored over 2,000 adults aged 51 and above for an average duration of 6 years. Those who were unable to rise from a seated position on the floor without utilizing their hands were found to be 5 to 6 times more likely to succumb during the study period. 5 to 6 times. The sit-to-stand movement engages virtually every major muscle group in your lower body simultaneously. Your quadriceps are responsible for straightening your knees. Your glutes extend your hips. Your calves provide ankle stability. Your core maintains your overall balance. Your back ensures your spine remains aligned. No other exercise offers such comprehensive muscle activation. And here is what elevates its potency even further. The sit-to-stand squat directly replicates a movement you perform dozens of times every single day. Every time you get out of bed, rise from a chair, exit a vehicle, or use the restroom, you are executing a sit-to-stand transition. By training this specific movement pattern, you are not merely cultivating theoretical strength. You are building functional strength that translates immediately into your daily life. The 2023 study referenced at the outset of this presentation found that adults over 65 who engaged in sit-to-stand exercises 3 times weekly experienced a 19% increase in bone density in their hips and femurs. This is exceptionally significant, as bone density typically declines with age. The mechanical stress incurred during the act of standing up from a chair sends vital signals to your bones, prompting them to deposit new tissue. Denser bones translate into a dramatically reduced risk of fracture should you happen to fall. Orthopedic surgeons have begun to prescribe this exercise as a form of preventative medicine. They recognize that patients with strong legs and robust bone density exhibit considerably better outcomes should they ever require joint replacement surgery. Many surgeons now mandate a minimum number of successful sit-to-stand repetitions before they will even schedule an elective procedure. To perform this exercise with optimal benefit, begin by sitting in a chair with your feet flat on the floor, spaced slightly wider than hip-width apart. Cross your arms over your chest to prevent any reliance on your hands for assistance. Lean forward slightly, ensuring your weight is shifted over your feet. Now stand up by pushing through your heels, rising completely until your knees and hips are fully straightened. Pause momentarily at the top position for 1 second. Subsequently, slowly lower yourself back to the chair over a 4-second count. Gently make contact with the seat, but avoid relaxing completely. Immediately initiate your next repetition. The critical element here is the controlled descent. This eccentric phase is where the majority of strength development occurs. If you simply drop back into the chair, you forfeit half the benefit of the exercise. If you are a beginner, start with 10 repetitions. Gradually work up to 3 sets of 15 repetitions. Once this level becomes manageable, consider holding a lightweight against your chest, such as a gallon jug of water, to introduce added resistance. Alternatively, you can prolong the descent to 6 or even 8 seconds, thereby increasing the challenge without adding external weight. Perform this exercise every other day to allow your muscles adequate time for recovery. Within 4 weeks, you will notice that everyday activities feel noticeably easier. Ascending stairs will no longer be an arduous task, and rising from low sofas will cease to be a struggle. You will move through your life with a renewed sense of confidence that you may not have experienced in years. Ultimately, these 5 exercises represent what orthopedic surgeons wish every patient over 60 would incorporate into their routine. Walking certainly has its merits, and maintaining cardiovascular health is undeniably important. However, if your objective is to preserve your independence, avert falls, maintain bone density, and keep your muscles sufficiently strong to genuinely enjoy life, targeted resistance training is essential. The research supporting this is overwhelming, and the medical community has reached a definitive consensus. Seated exercises that challenge muscles against resistance yield superior results in terms of functional strength when compared to walking alone. You do not require a gym membership, nor do you need expensive equipment. You need not even be particularly athletic. All that is required is a sturdy chair, perhaps a resistance band, and approximately 15 minutes 3 times per week. This modest investment of time can genuinely add years of independent, active living to your life. Begin with exercise number 5 today. Master it over the ensuing week, and then introduce number 4. Progress through the list at your own rhythm. By the time you reach the sit-to-stand squats, your body will be optimally prepared for the challenge. Your future self will express gratitude for the strength you cultivate today. Now, we are eager to hear from you. Which of these 5 seated exercises are you most enthusiastic about trying first? Have you ever been advised that walking is the sole exercise necessary after the age of 60? Please share your experiences and perspectives in the comment section below. We would genuinely appreciate your input. Thank you for watching.